delusions or hallucinations in spite of major sort of relief on treatment. So in those cases, it is important that they understand the distinction between what is real and what is not real and what is part of their illness. So therapies allow individuals to understand that, and miraculously, I say it because I think of a few of my patients who are able to identify hallucinations as hallucinations per se are not part of their reality, and they can stop themselves from reacting to those voices, and now they lead their life very well. So uh, I want to say here that sometimes we have treatment resistant schizophrenia also, which is where, like, the patient symptoms are not responding 100% to medications. And in those cases, also, we take the help of therapy to establish a sort of insight so that at least the functionality comes back. And this is also helpful because a lot of patients might, once they get better, emphasize that they don't want to continue treatment because initially people do consider or question the fact that medications for this can end up being lifelong or very long. So those are the treatment modalities we look at. Along with that, we have modalities, biological modalities like RTMS also these days, where in individuals who are not responding to any form of medicines, or side effects are so severe that we feel that something else might benefit them. So then we use RTMS and ECT. Just ECT is something which is again a very wonderful form of biological treatment, and जिसको जनरल आम भाषा में शॉक ट्रीटमेंट या शॉक थेरेपी बोलते हैं, और उसको बॉलीवुड में काफी डेमोनाइज किया हुआ है, but it is a wonderful modality of treatment. And with the newer mental health act now, it is done in very human conditions. So definitely past has been really murky about it, but it's a wonderful form of treatment that is still used with good results.
Thank you for sharing that. Navya, would you like to come in and add anything, in your experience with families, and, how, what are the challenges families face while caring for someone with schizophrenia?
Right. So, as we were discussing about, there was lots of myths regarding schizophrenia. A lot of families do have inclination towards the religious practices. So, when we as a psychologist work with the family members, making them understand about the disorder, psychoeducating about the illness,